November is Bladder Cancer Awareness Month. And on our Bronson Health Chat this morning, we're bringing awareness of bladder cancer to the forefront with special information about bladder cancer and the symptoms and the like. Dr. Pamela Barron from Bronson Urology and Continence Specialists is joining us this morning on WKZO. Dr. Barron, good morning.
Good morning.
Thanks so much for joining us. So, bladder cancer, how does it occur?
So with bladder cancer, it occurs when the cells in the bladder are starting to grow out of control. A lot of times these develop on the inner layer of the bladder, but some can grow into deeper layers of the bladder. And when that happens, it does become a little bit more difficult to treat.
Is this a common form of cancer? What is the incidence of bladder cancer in our public these days?
It is common. In 2018, 81,000 individuals will be diagnosed with bladder cancer. Over 17,000 individuals do die from this type of a cancer as well. In men, it's the fourth most common cancer, and for women, it's the 11th most common cancer.
Are there signs and symptoms of bladder cancer that we should be aware of?
Yes, there are. The most common sign of bladder cancer is blood in the urine. But unfortunately, this blood can be occasional and short-lived. There also may be no pain associated with the blood in the urine, which can lead to some individuals ignoring these signs or delaying their seek of care for this symptom. A lot of times these tumors don't produce enough blood for an individual to see, but can be picked up on a urine specimen that might be done for other reasons. Blood in the urine, though, does not always mean that you have bladder cancer. Infections, kidney stones, and sometimes blood-thinning medications such as aspirin can cause bleeding as well. The real way to detect it is by doing a urinalysis that's ordered by a physician to check and see if there's any concern.
So if someone does detect blood in their urine but doesn't have, say, a UTI, what should they do?
With that, they really do need to follow up with their primary care physician to seek referral to be further evaluated, because there can be times where they think blood in the urine may be related to a urinary tract infection, but if a urine culture is negative, that does warrant much further workup with a specialist such as a urologist like myself.
Are there risk factors involved, doctor, for bladder cancer?
Yes, there are. Smoking is a big risk factor. Also, past chemical exposures can predispose you to bladder cancer. And Caucasians are actually twice as likely to develop bladder cancer itself. If someone has chronic bladder inflammation, that can also predispose you to developing a bladder cancer.
So do you recommend that people be screened for this periodically or at a particular age?
Not necessarily having a routine screening. A lot of times urinalysis can be checked as a part of routine labs with a primary care physician, and sometimes it is picked up that way. If there is blood that people are seeing in the urine, that of course should prompt them to call at least their primary care physician to start the workup to see what else is going on, what's the cause of this. That certainly is one of the things to check.
Well, obviously, you can get more information on that by consulting your physician or specialist, but are there other places we can go to learn more about bladder cancer and the risks involved?
There are some websites that are out there that are pretty good, and actually our American Urologic Association does have a lot of patient information through their patient health part of their website as well that you can click on for bladder cancer and other urologic conditions as well. That gives a lot of great information.
Well, November is Bladder Cancer Awareness Month, bringing awareness to the forefront by making sure we are all educated about what it involves and how to treat symptoms and the like. And we thank Dr. Pamela Barron from Bronson Urology and Continence Specialists for joining us this morning on our Bronson Health Chat on WKZO.